Welcome, everybody. Once again, my name is Tina Costa, and I'm one of the directors with the PHSA Office of Virtual Health, continuing to have the pleasure to be your virtual host. My pleasure to welcome or re-welcome those just joining to the 2023 BC Digital Health Forum. For anyone just joining in today, joining our virtual circle, we encourage you to share in our collective gratitude for the opportunity to come together from many traditional, ancestral, and unceded territories of BC First Nations. Let us continue to give thanks for the opportunity to gather, learn, collaborate, and provide care on these beautiful and sacred lands. It is now my pleasure of providing a condensed introduction for our next presenters. We have Emily Chan, Joyce Chan, and Sonya Kung. Emily is a certified project management professional and scheduling specialist with over 10 years of diverse experience in both private and public sectors. She recently helped launch the PHSA Digital and Virtual Health Atlas product under the Provincial Digital Health and Information Services portfolio. Joyce is a leader from the PHSA Provincial Digital Health and Information Services. She holds a health sciences degree and is certified in project management and UX design. Joyce manages the planning and implementation of care delivery transformative initiatives, including the BC Digital Health Atlas and the Perinatal Services BC Perinatal and Newborn Health Hub. Sonya is a coordinator at the Provincial Health Services Authority with Provincial Digital Solutions. Sonya's educational background and work experience are in the world of human factors and ergonomics, also known as human factors engineering. Please join me in welcoming Emily, Joyce, and Sonya on their talk entitled The BC Digital and Virtual Health Atlas, Translating New Knowledge and Nurturing Innovation. Over to our presenters.
Thank you, Tina, for the introduction. Sorry, I was just getting my screen up. Is everyone able to see it?
We can, yes.
Perfect. So thank you so much. And we're so glad to be here. We made it to Thursday. It's been a very awesome week of learning. And we're really excited to be here today to talk about an idea that we were able to bring to life with the help of many colleagues in our core project team. We're also very humbled to be able to present alongside many accomplished colleagues in our sector. And the Atlas is still in its infancy right now, in being not just a product, but a program that we hope can help us solve many problems in the future. I want to, before we get started, I'd like to acknowledge with gratitude that I'm specifically calling in from Surrey, which is on the unceded territory and lands of the Semiahmoo, Katzie, Coquitlam, Kwantlen, Kakite, Tsawwassen First Nations. So about our journey, there's a lot to our story, and we'd like to take the time to walk you through our journey of problem solving and looking at opportunities that led us ultimately to creating the Atlas. Although it looks like a simple conversation about a problem and solution, the problem itself is not, the problem itself is a lot more complicated than how it looks here. Additionally, if you have any technical questions about our methods and approach, we have included some extra details at the end in our appendices that we can share. We use some cool evidence-based frameworks to capture our requirements and integrate it into our chosen prototyping methodology. So what's in a name? We'd like to invite you to think about the word atlas. What is an atlas? We've put the Merriam-Webster definition here for you to take a look. When building the solution, we draw inspirations from the concept of atlas. An atlas is a bound collection of maps, illustrations, facts, and more. The many definitions became a great analogy for the product we aim to build. So we want everyone to keep this in mind as we walk you through our journey today. So this is the beginning of the problem, or the groups of problems that we were trying to identify and solve. Digital and virtual health is complex, new, and takes time to demonstrate its value. We recognize there is opportunity for better coordination and collaboration across the province. From here, we needed to find a way to further break down this problem. In order to find some guidance on our goals and purpose, our team underwent an exercise in defining our product strategy and visioning to help give us some direction. Our product vision, we decided, is to become a center of excellence for digital and virtual health. And our mission is to drive healthcare transformation through digital and virtual health collaborations, innovation, and knowledge mobilization in BC. To help us provide a baseline, we did a case study on an existing platform called the New South Wales Innovation Exchange. We noticed some interesting key features about this platform. It was a place for healthcare professionals to share digital and virtual solutions. It was a learning platform for innovation, and it also helped users connect and network with each other. It prevented duplication of work and is a predominantly user-driven content management platform. So what did we learn from this case study and what outcomes were apparent? Jurisdictions around the world are also interested in investing in knowledge translation and exchange as a key factor in excellence and innovation. It is apparent that New South Wales Innovation Exchange has been in place since 2014, and it's a vibrant resource, and it's also feasible and sustainable as a model, which is something that we were highly concerned about, making sure that something like this could continue. Efficient healthcare design requires a community of practice facilitated by tools like this, and also the Atlas, which we're trying to build. So I'll pass it over to Joyce to dig into the problem a little bit more.
Thank you, Emily. Moving on, I'll walk us through on how we took a threefold approach to understand the problem that we're trying to solve. We needed to analyze how digital health was being seen at the different levels. So nationally, we analyzed the digital health and virtual health trends in Canada to identify the general needs. And then we move on to aligning the problems with the provincial strategy and mandate in digital health. Across the organization, we engage the potential users to test out our prototypes and to identify the pain points. Starting from the national trends, these were the key data summaries that we look at to help us build our case. We learned that the public wants more strategized investment in innovative technology. People want to be more confident in healthcare resources when it comes to making health-related decisions. Digital health leaders are demanding technical interoperability as the priority when it comes to our health system. We see the opportunity for a solution like the Atlas to help address some of these gaps. Provincially, we align the needs identified with the goal and objectives under the BC Digital Health Strategy. This strategy guides the provincial's effort in creating a digitally enabled health system by empowering patients to interact with the health system, leveraging digital tools and access to information to improve provider experience and reduce administrative burden, enabling exchange of provincial health data through a connected health system, and integrating solutions to enable a business enterprise. The Atlas helps integrate content and tell the stories about these outcomes and how they apply to our overall healthcare environment. What we're seeing here is the provincial virtual health inventory. Back in early 2021, static data was collected from various health authorities and organizational partners on their virtual health activities and initiatives at that time. The information provided were varied in project details, resulted in a lot of time compiling and standardizing the information. It was also not user-friendly to view information this way. Ultimately, creating the BC Digital Health Atlas was the solution to standardize the information on these projects, creating a collaborative content management platform that's easily accessible anywhere and anytime. This slide captures the engagement we had done so far throughout different phases of this project. Over 120 initiative data were collected from organizations across the province to help us update the inventory in 2021. We then maintain continuous engagement with virtual health and digital health and program leaders through the development process of the Atlas to collect user feedback. We had done a series of focus groups and later transcribed the feedback using the radar technique. These are a few pain points that were captured. Users find that the current system is not intuitive to find resources. They want to learn about digital and virtual health work that's happening across the province and expand on it. They want the ability to access and filter the data to better identify trends. From there, we package the requirements and embark on a rapid prototyping journey. Next, I'll pass it on to Sonya to share more about our product and solution.
Excellent. Thank you, Joyce. So after several building our proof of concept, a few target engagement workshops, we were able to create this minimal viable product, the MVP, to help us solve some of the problems that we want the Atlas to solve. And so on to the next slide. Now that you've seen the methodology and solution, we want to revisit our inspiring product vision and mission. And on to the next slide. The main goal and objectives on the Atlas is to be an online knowledge translation tool to increase awareness of digital and virtual health resources in British Columbia. The Atlas contains a broad range of information, such as the ways to provide our province's healthcare system a better understanding of how various digital and virtual health initiatives can be integrated into clinical services and benefit care delivery. The Atlas also helps with knowledge exchange, in which provides guidance on digital and virtual health implementation and increases the visibility of quantitative learnings, and these learnings include new opportunities or even challenges. And of course, last but not least, the Atlas supports BC health leaders in improving the healthcare system planning, quality improvement, and collaboration. And of course, now the moment you've been all waiting for, we'll show you our exciting demo that presents a glimpse of our beautiful BC Digital Health Atlas. Thank you.
Welcome to BC Digital Health Atlas. The Atlas is a dynamic and interactive knowledge translation tool that shares the many exciting digital and virtual health initiatives across BC through open collaboration from all healthcare communities. The Atlas will be the first of its kind, serving as a one-stop shop for best practices of all digital and virtual care initiatives with specific, actionable information and data insights. The Atlas holds key knowledge for providers, patients, and health system planners to help leverage shared learnings to create and rapidly deploy more efficient digital or virtual care implementations. Whether planning a new digital or virtual health project, seeking resources to learn and connect with other program leaders, or looking for data and trends, the Atlas supports you in one place. Your projects aren't one-dimensional, and your tools shouldn't be either. The Atlas creates different ways to search for digital and virtual health information that fits your use case or clinical needs. To make navigation easy, content has been organized into professional categories where you can start your search with a single click. Check out initiatives and stories and see how health professionals and clinicians use tools and technologies. Learn more about health system planning to find interoperability toolkits, vendors, and experiment in a sandbox environment. Dive into the Data Insights corner to gain deep insights in virtual care utilization and trends in BC through our data visualization. Read more on practice and education to assess your own virtual health practice competencies and review the latest policies and guidelines by health organizations. Check out Patients and Community to access information resources and education on digital and virtual health as a patient, family member, or community partner in healthcare. Digital Health Innovation Exchange is a place to keep up with the latest research and events, contributing your ideas for the future of digital and virtual health. Lastly, the Resource Library is a curated collection of digital and virtual health documents, articles, e-learning resources, and much more. Interested in exploring BC's virtual health landscape in another way? Let's go for an adventure and explore the Atlas map view together. By viewing initiatives and stories visually and geographically, we can see the spread and influence of digital and virtual health across the province through different health authority regions. This can be a visually insightful way to view gaps and opportunities in our healthcare system. See something you are interested in? Got a keyword in mind? The advanced and dynamic search features help you to get a deeper insight into a specific topic of interest. Let's look at the My Guide Long COVID initiative page together. At first glance, we can view this project's overall scope, highlights, and impact at the top of the page. There's even a feature video available. Every project is self-assessed using a combination of the BC Health Quality Matrix Companion Guide and Canada Health Infoway Technical Dimensions of Virtual Health Experience. As we scroll further, we can find more comprehensive details about the implementation and key goals of the project. There is also a space to create and link related stories, videos, and articles that help capture experiences beyond the report or assessment. We can also see some of the top lessons learned with measured outcomes in a format tailored for bite-sized learning. Last but not least, we can find crucial information on how this technology came together and was selected. There may even be helpful resources below. Lastly, check out the Virtual Health Competency Self-Assessment. Use this foundational practice tool to complement your existing practice and professional clinical standards and resources. It is flexible, practical, and can be applied across diverse clinical settings and disciplines. Welcome to BC.
All right, so thanks so much for your time in attending our presentation and watching your video. If you're excited to see more, stay tuned for our upcoming launch. We don't have a specific date, but we can guarantee you it is coming soon. If you have any questions or you're interested in reaching out to us about our MVP and our prototype, you can contact us at atlas@phsa.ca if you have any questions. So now we can move into Q&A.
Awesome. Thank you so much, Emily, Joyce, and Sonya. The Atlas really does, it obviously aligns with the theme of the conference and around collaboration, but really helps to, you can see that strengthen that community across BC, that digital health community, bringing us all together into one place. So thank you for your presentation. We've got a few comments and questions. First, started with a comment, great work, valuable cutting edge resource. Question is it open for everyone to use, or are there levels of access?
So right now we're starting small in terms of our user base. The launch is really going to be targeted more so towards healthcare users in different health authorities, most likely mainly PHSA and other virtual health leaders across BC. The public would be able to access the domain, but it's mostly going to be communicated and targeted within the health authorities for now. And we're going to start growing our beta users to keep testing, adding more content, and eventually keep growing. It is in its infancy right now, as I had mentioned earlier, so it is an MVP. So please expect it not to be perfect, and it's not a fully fleshed out finished product just yet.
Fantastic. Yeah, question was coming from a patient partner, so great to know that the public will have the ability to see it. Question 2, do you have long-term funding to keep the information up to date?
So I can also answer this question. So yes, we do have funding to keep this ongoing. It was developed in alignment with a few other products for economies of scale. And so we've done a lot of long-term planning in terms of making sure that within the PDHIS portfolio that it's aligned with what's happening in the future with enterprise architecture. We have other products that are built on the same platforms, and we've set it up so that other products can leverage what we've built off of in the Atlas and the Hub and My Guide Long COVID in the same ecosystem. So yes, so it will be staying in the long run.
That's great. That speaks to sort of one of the other questions around, are there plans to create similar sites for other care teams? Yeah. Fantastic. Another question, or a couple, I'm going to combine two from our patient partner perspective. Let me just pull that up again. Were patient partners and/or accessibility guidelines included in the development process?
So We did include some feedback with folks that work a lot with patient partners. So one of our initiatives does address accessibility. So we did get some feedback from the Provincial Language Services team. We haven't really tailored this product yet to be targeted to patients. And so I think in the future, what we're going to do as we develop more features and try to solve more problems with this product is start engaging those partners, because we wouldn't want to develop something without their help, especially if it is targeted to them. So a lot of the current features that exist are really targeted to virtual health leaders, because this is the knowledge that we have access to right now. And so in order to develop our rapid prototype with our methodology, we wanted to utilize data that was available to us immediately, and start small and go from there and build it up. So it's not a finished product, and it's open to lots of opportunities, lots of discussion, lots of improvements, and lots of engagement.
Incredible. We've got time for a couple more. I'm not sure if you want to speak to this, but maybe someone might be able to reach out to you, but someone's curious about the foundational financials.
I'm not quite sure how to answer that question. I'm not sure if the person asking that question could clarify a little bit more about foundational financials.
Maybe they're wondering just about the financial, what it takes to get it started, but maybe we'll leave that and they can reach out to you specifically, or who else on the team they would need to talk to about the financial aspect of it. We'll move on to another question. Again, a comment, amazing work. Question is, what has been most challenging about establishing this new platform?
I think it's an interesting and complex problem that we are trying to solve. And it's not addressing one specific clinical problem. And so we're kind of from scratch building something that we're not sure how people want to use it. And so I think for us, it's both interesting and also challenging to really not know the full picture of what we're trying to do, but it's also the fun part of prototyping and building a product. And I don't know, Joyce, if you want to speak to it. I see you've unmuted.
Sure. Yeah, I would say there are a couple of things that we try to keep in mind while we're developing the product, the platform, is to make sure it's a user-centric approach, and keeping it as a co-design product. So that I would say one of the things that would be I'd say somewhat interesting is how to filter through all the requirements that we're getting from everywhere, and in all of our user research and experience that we have done through like focus groups or like interviews. We definitely had received a lot of nice and great and nice to have features, and also some very important features that we'd like to have present on the atlas. So the process of screening through them and prioritizing them is also keeping it as an iterative approach, so that we know that the feature will be there, and we're slowly adding them, making it a product that will fit more of our users and use cases.
Great. Another couple of comments around the patient partner aspect, and I wonder if you guys can highlight the features on the atlas that focus in on our patients.
I'm not sure. Sonya, do you want to take on this one, because you helped upload a lot of the content for the resource library?
Yes, I can definitely speak more of that. So yeah, the resource library is a curated collection of articles, of videos, and etc. So pretty much all of them are crossed from health authorities, and yes, we've had patient partners involved, and yes, that is something you should definitely check out when the atlas comes out. Emily, would you like to add anything, or Joyce? Thank you.
Sure, I will add a bit.
Oh, sorry. Go ahead,
Right.
Joyce.
Just a quick comment. Yes, we have also the infrastructure built out on like some filters for filtering like patient education or patient involved initiatives, so that when we have the infrastructure ready to help with users filtering through those information.
And then just to finish off, resources that are patient-centered and patient-focused that have been added to the Atlas, those have been worked on with patient partners. We were just kind of the intermediary, the medium to post them onto the platform. In terms of features on the Atlas, though, we don't want to build out anything that's patient-centered without engaging them properly. So I think there's going to be lots of opportunities to do that in the future. So we want to be really cognizant of working with those that we're trying to serve. For in the future, when we do have more capabilities to have more patient related features and resources, we definitely want to have a working group with patient partners to help develop that and do some fun exercises and developing prototyping.
Fantastic. And just wanted to note, there's a great comment in the chat for all of us as digital health leaders is to expand our definition of digital health leaders to include patient partners. So just a challenge for all of us in this space. Thank you again. We'll close here because we're going to transition, but just wanted to say thank you to Emily, Joyce, and Sonya once again for showcasing what is such an incredible resource. I know it will just grow astronomically as you guys move forward with your projects. So you will see the audience, you'll see a Zoom poll come up to get a bit of the feedback. Sorry to those that we didn't ask any or get a chance to answer questions. Please reach out to the Atlas team to learn more about it and get those questions answered. As we wrap that up, we're going to invite you to our next session, which is entitled Beyond Passwords and Firewalls, Enabling Healthcare Professionals with Accessible, Real-Time Clinical Care Information and Resources. Again, navigate there on the left-hand side on the panel on the left-hand side, and we will see you all shortly. Thank you so much, Atlas team.